Well, good morning, everyone, and thank you, Barbara, for that kind introduction. And certainly the Economic Club of New York has a very long history of promoting serious discussion on some of the most important economic, social, and political questions of the day. And it's certainly an honor for me to be able to be here with you this morning and share my thoughts on, some of the pain points that exist in our country's healthcare system. And I'll start with the fact that the current system was built to provide acute care in a fee-for-service world, not to provide coordinated care to the chronically ill, who now make up about 1/2 of the U.S. population. Nor was it designed to meet the changing demands and expectations of patients who are increasingly looking for more value, greater convenience, and more help in making healthier choices every day. And the result of all of this is a fragmented system that has produced high costs and, let's call it, not so good health outcomes, and one that many patients experience as a maze of confusion. And many of you, have experienced these challenges not only as patients or caregivers, but also as business leaders and employers. So today I thought I would focus on 3 of the more significant pain points, and that's the rising costs of healthcare, the challenges in accessing primary care, and the growth of chronic disease. In addition, I'll discuss some of the shifts that are needed to improve outcomes and drive down spending, and some examples of some sensible market-based approaches and opportunities to do so. So let me begin with that first pain point, rising costs. If you go back and look at healthcare spending, it was healthcare spending as a percent of GDP. It was 5% back in 1960, and it's on today. It's on a trajectory of 18%, approaching 20% within the next 10 years, and that extra 2 percentage points would amount to more than $250 billion, undermining our country's ability to fund every other critical priority, whether it's education, infrastructure, certainly that list goes on. And these cost increases have a huge impact on the budgets of employers, public programs, and they are increasingly affecting the pocketbooks of everyday Americans, and here's why. First, employees' health premiums have been rising at about twice the rate of salary increases. Second, more employees are enrolling in what is referred to as high deductible benefit designs. And today nearly 30% of covered workers are enrolled in high deductible plans, and that compares to about 4% a decade ago. And these plan designs are intended to introduce more consumerism into the healthcare system. However, you think about approaching healthcare with a consumer mindset, that's a very, very new experience for many people. And what people want is affordable healthcare, and they need innovative tools as well as simple and clear information to help them be more effective healthcare consumers. So maybe said another way, I think we've pushed healthcare accountability and decision-making towards the patient, but healthcare literacy and the tools to empower patients are lagging behind the expectations of consumer-driven benefit designs. Now, since medications are involved in about 80% of all healthcare treatments, one significant opportunity to lower costs for consumers is the way in which prescription drugs are procured, priced, and managed. If you look at the pharmacy landscape today, more than 87% of prescription drugs dispensed all across the country are generics. And if you look at the average out-of-pocket cost for one generic drug that may be taken as part of a chronic disease, as part of one's daily regimen, the annual cost to that patient is less than $70, annual cost. And we've heard a lot about prescription drug pricing, so you turn around and say, wait a minute, less than $70 for a year, 87% of the prescriptions, so what's the problem? Well, the real problem relates to that other 13%, which are brand name drugs. And pharmacy benefit managers, are commonly referred to as PBMs, they do an effective job in driving down drug prices for their clients, whether it's an employer, health plan, or government clients. And over the next decade, PBMs are projected to save clients more than $650 billion on drug costs. And they do this by leveraging the purchasing power of millions of Americans and by deploying a variety of tools and capabilities to ensure that their clients and their clients' members receive the right pharmacy care at the lowest possible cost. Now, traditionally, physicians have not had visibility into their patients' benefit plans to know what programs are available for each of their patients, or the costs associated with the various medication options, or where patients may be at in their deductibles. And with the growth in our business of electronic prescribing and electronic health records, that's no longer the case. It is now possible for PBMs to transmit important benefit and formulary information to both the patient and the physician through the patient's electronic health record. You can provide drug pricing and other valuable data at the point of prescribing. And this creates an opportunity for more informed dialogue about the most appropriate course of treatment, which can prevent what we refer to as sticker shock that many patients experience today at the pharmacy counter when they go to have their prescription filled. And it's bigger than just pharmacy. There are similar opportunities that exist across the entire healthcare system. And take MRI scans as an example. According to data that has been compiled by Medicare, an MRI could cost you as little as $470 or as much as $13,000, depending on where you have it performed. At the same time, there are billions of private sector dollars being invested in developing more cost-effective comparison tools and other technologies, whether it's mobile applications, wearables, cloud-connected devices. And all of this is intended to help individuals and their physicians make more informed decisions about health and their health care. And as patients continue to take advantage of these new tools and act more like consumers, they will help spur even greater competition among healthcare providers. And we think that that will go a long way in helping to lower the overall cost of care. Second major pain point, access to primary care. Most experts agree that primary care physicians should serve as the medical home for all patients. However, the expansion of health coverage is part of the Affordable Care Act, and 10,000 Americans reaching retirement age every day, and that's going to continue for another decade. The system is becoming overwhelmed by the increased demand for service. In just the last 3 years, the average wait time for a physician appointment in large metropolitan areas has increased by more than 30%. And it's projected that by 2020, it's only 3 years away, that the U.S. will experience a shortage of more than 45,000 primary care physicians. Making matters worse, patients without a primary care physician or who simply can't get an appointment, what do when they're sick? They often turn to the least cost-effective site of care, and that's the emergency room. So clearly, there's an opportunity to help consumers more easily access health services, whether it's in their communities, in their own homes, or through digital tools. And that's why one of the most encouraging changes taking place in healthcare today is the expansion of lower-cost sites of care. And we've been calling this the retailization of healthcare, and we think it's just getting underway. As an example, urgent care centers, walk-in health clinics, they're growing rapidly. They're up to 80% less expensive than the emergency room for the services that they provide, with the same or even better outcomes. We think this makes them an ideal complement to primary care. Another convenient option is in-home care, where treatments such as infusion services can be provided at a much lower cost than in a medical facility and with greater comfort for the patient. And as the population ages, we think this will become an increasingly attractive option for those who prefer to, let's say, age in place. The next frontier of accessible care is telehealth. Imagine how different our healthcare system will look when millions of Americans can use an app on their phone to teleconference with a physician from maybe a walk-in clinic, or perhaps their home, or maybe a hotel room halfway around the world. That's where healthcare is headed, and the future is not that far off. I do want to emphasize that these additional care options do not replace primary care physicians. They complement and extend primary care. In addition, it's critical that the care provided through these and other low-cost sites be connected and integrated through the patient's electronic health record to avoid the risk of fragmented care. So that leads me to the third and final pain point, and that's the growing prevalence of chronic disease. I referenced earlier, today 1 in 2 Americans have at least one chronic disease, such as heart disease, hypertension, diabetes, and the numbers are growing. Today, it's estimated that more than 80% of all healthcare spend goes to treating chronic illnesses. And ineffective management of these conditions and the medications associated with them is estimated to cost more than $300 billion per year in avoidable costs. For example, research indicates that about half of all patients in the U.S. do not take their medications as prescribed. And up to a third of prescriptions that are written never even get filled. This leads to, as you would expect, some serious consequences. Today, about 1 in 5 patients who were discharged from the hospital are readmitted within 30 days. About 3 in 4 of these readmissions are preventable, and 2 in 3 actually relate to a medication issue. This is simply unsustainable, particularly as the population ages and more Americans transition across care settings, such as the hospital or the home or into some long-term care facility. So there is tremendous opportunity to make healthcare much more effective by engaging with patients more frequently where they are and coordinating care to make a complex system much easier to navigate. And we certainly see pharmacy care playing a significant role because you think about a patient with a complex disease like diabetes. They will visit their pharmacy more than 30 times a year. Okay, that same patient, if they see their physician on a quarterly basis, 30 times in the pharmacy, 4 times in the doctor's office. So pharmacists can play a more active supporting role in each person's unique health experience, from advising them on the best use of their medications and improving medication adherence, or helping to coordinate care more effectively among a patient's healthcare providers. And research has shown that programs that include one-on-one counseling between patient and pharmacist are 2 to 3 times more effective at improving just medication adherence than any of the other interventions that are possible, and they result in cost savings of about $3 for every $1 invested. In addition, the ability to analyze big data has enabled interventions in pharmacy care that can support pharmacists in ensuring that patients receive high-quality care. And at CVS Health, as an example, we have developed what we refer to as the Health Engagement Engine. And this engine, not only analyzes our own pharmacy data, but it also looks at data from other payer sources, including health plans, providers, and health systems. And this creates a much more holistic view of the patient, along with the ability to exchange information with the insurer and the physician through the patient's electronic health record. For example, we can notify doctors when patients are not refilling their prescriptions, and doctors can alert us to patients who have some very complex regimens where we may be able to provide more support by helping to synchronize all of their prescriptions onto a common fill date. We've even developed a pretty accurate way to predict when fragile patients might need extra support, such as when they're about to be discharged from the hospital or transitioning perhaps into a skilled nursing facility. And by intervening at these critical moments, we can help prevent some of those costly readmissions that I alluded to earlier. Now, utilizing this data we see it as a crucial opportunity in healthcare today. Today, I would describe the system largely analyzes data reactively to determine the cause of a health event after it occurs. Going forward, the ability to translate data into actionable information proactively, predicting and preventing events before they happen, I think that will really start to move the needle in a way that produces better outcomes at a lower cost. So let me conclude where I began, okay, and that's that the healthcare system that we have today, it wasn't built to adequately address the pain points that are all too familiar to us. And fortunately, there are many opportunities to improve outcomes and drive down costs, and I am optimistic about the changes that have been taking place. At CVS Health, you think back to Barbara describing the capabilities that we have. We think of ourselves as being the front door to healthcare. We touch the lives of 1 in 3 Americans, and we're playing an active role in providing more affordable, accessible, and effective care. And we're not alone in this effort. There are tremendous investments that are being made in private sector innovation to improve healthcare and reduce spending, and market forces are helping to increase choice and competition, empower patients as consumers, and to make this complex system easier to navigate. At the same time, there are important public policy changes that can be made to help accelerate these opportunities. And just to mention a few, let's continue to increase competition in the prescription drug market. Today, there is a backlog of more than 3,000 new generic pharmaceuticals that are waiting approval by the FDA, giving priority review to drugs for which there is no competition and increasing speed to market of new biosimilars. And I know the new FDA Commissioner, Dr. Scott Gottlieb, shares these priorities, and I applaud him for the actions that he has been taking. Second, let's accelerate consumerism by modifying the rules around health savings accounts. I know many in this room, you probably have that as part of your health insurance. Currently, the rules allow employers to cover certain preventive drugs for chronically ill patients at little or no cost outside of the patient's deductible. However, patients are required to start paying for their drugs as part of the deductible once they get sick. Now, you may be sitting here at this point saying, Larry, you got that backwards. No, I didn't get it backwards. And we believe that plan sponsors should have the option to cover all prescription drugs for little or no copay outside the deductible at any time, if that's how they choose to structure their benefit. Now, third, given the importance of their role, let's empower pharmacists to spend most of their time taking care of patients, not doing administrative work, and allow them to practice to the top of their license. I know all of you have a huge stake in the debate over the future of healthcare, so I hope you'll stay actively involved. Before I conclude, I want to say a word about a very important topic in healthcare, and that's the alarming and heartbreaking opioid epidemic. In the last 2 decades, opioid prescribing rates have increased nearly threefold. This remarkable volume of opioid prescribing is unique to the United States, where prescribing in 2015 was 4 times what it was in Europe. This epidemic has no single cause. It doesn't discriminate. It exists in our cities and the suburbs, across rural America, among all socioeconomic groups. And addressing it requires a multi-pronged effort involving all healthcare stakeholders, whether it's physicians, dentists, pharmaceutical companies, pharmacies, insurers, and government officials. At CVS Health, we will continue to be actively engaged and do our part. In the last 2 years, we've worked with local law enforcement across the country to collect and safely dispose of what now amounts to more than 100 metric tons of unwanted medications. And next year, we'll double down on these efforts, installing another 750 drug disposal collection units in retail pharmacies across the country. We've worked and partnered with now more than 43 states to expand access to the opioid overdose reversal drug, naloxone, to help save lives and give people a chance to get the help they need for recovery. We also have a program that we refer to as Pharmacists Teach. We have 30,000 pharmacists all across the country, in local communities across the country. And these pharmacists go out into their communities, into the schools, to educate students about the dangers of prescription drug abuse. And to date, we've now touched more than 300,000 students through this program. One of the most difficult challenges, however, is changing prescriber habits for, I'll call them, acute injuries. And how many of you have had the experience where maybe it was a dental procedure or some acute ankle injury, knee injury, and you've left the office with a prescription for 30, 40, 50, 60 powerful pain pills? And I see a lot of head nodding, okay? As a leading stakeholder in pharmacy care, we believe it is time to institute limits on the quantity of opioids dispensed to patients who are receiving opioids for the first time, and to ensure that the prescription fits the medical condition. So utilizing our retail pharmacies and our PBM services, we will work with physicians, patients, plan sponsors, and other stakeholders to limit to 7 days the supply of opioids dispensed for those certain acute prescription needs, while continuing to ensure that patients that have critical chronic needs continue to have access to appropriate care. So thank you again for the opportunity to share my thoughts with you, and I look forward to the discussion with Susie.